about these two specific properties and help these people move on and provide 10 to 20, maybe 30 jobs for our residents in our town who want to stay here and not have to travel outside Yarmouth to work. Thank you and have a good evening, and happy Mother's Day to all you mothers.
Okay, thank you for coming in. Stay safe. Any comments from the board or not?
Mr. Bosky, do you have a Kaylee Anarino who has her hand raised?
Okay.
Thank you, Mr. Chairman. Hello, my name is Kaylee Anarino. I'm a year-round resident on Cape Cod, and thank you for giving me this opportunity to provide a brief comment this evening. I had prepared a brief comment for the meeting today in support of COVID-safe outdoor events on town-owned land in Yarmouth, specifically highlighting the positive impact that this reissuance will have on the struggling nonprofit community in the town of Yarmouth without interfering with CDC guidance and safety measures. And given Baker's announcement last week, we seem to be in a good shape for gradual reissuance of outdoor events soon. And I'm sure today's agenda will review this in more detail. However, I would like to quickly speak about the positive impact that these events have on the nonprofit community overall. My fiance and I are planning with faith and patience to have our wedding on September 10th, 2021 at Taylor Bray Farm in Yarmouthport with no more than 150 people invited. As born and raised Cape Codders together for 10 years, it has always been our dream to get married at Bray Farm, a location with significant sentimental value for us. He even proposed to me there on Christmas Eve. And it warms our heart knowing that our wedding could also bring some much needed financial support to the nonprofit community in the town of Yarmouth, who, like others across the Cape, have struggled dearly throughout the pandemic. In addition to the financial donation we plan to make to Taylor Bray Farm Preservation Association, we also plan to donate our time volunteering on the grounds for years to come. With the reallowance of outdoor events on town-owned land, others will be able to support nonprofits in their own ways like this, whether they are planning a wedding or a fundraiser, road race, town cleanup, etc. According to an economic impact survey conducted by the Cape Cod Commission, which I'm sure you're all familiar with, both permitting and development and fundraising support were identified as two chief areas of need amidst the pandemic. The reissuance of outdoor events on town-owned land could be one quick way to meet these top needs without going against the current CDC and state COVID-19 mandates. We will continue to monitor the state guidelines and rulings set by the Yarmouth Board of Health as we approach September. And I look forward to witnessing the benefits that this reallowance will have on the struggling nonprofit community in the town of Yarmouth and across the Cape, all while remaining safe and in line with COVID-19 protocols. As you know, the vaccine rates are expected hopefully to reach 75% before Memorial Day, and the Cape is leading the charge in the state with 47% of residents fully vaccinated, 64% having received at least one dose. And I'm confident, given the positive news we're hearing in terms of the pandemic, that these events will be able to be conducted safely. And I look forward to hearing more during the agenda today. And I thank you very much for your time and consideration.
Thanks for coming in, and congratulations, and stay safe. Anyone else in the
I
public?
could make one point here, Mr. Chairman, and to the board,
Sure.
that on August 1st, right now, the governor is removing all restrictions. So the wedding would be in September. So as we look forward to right now, I would not be looking that there would be any restrictions on the wedding or the number at 150 at this time.
Okay.
Thank you.
And we're also working with Taylor Bay Farm on some other weddings prior to August 1st that we'll be discussing. And I know we're coming up with discussing a policy later on is how we can work with people and going over their COVID safety plans for different events at different locations in town.
Mr. Chairman, you have an Elizabeth Glavinski who would like to speak.
Sure. Welcome. Just introduce yourself. Thank you.
Great. Thank you for your time. Elizabeth Glavinski, lifelong resident of Yarmouth, Massachusetts, and just like to echo much of the sentiment that Kaylee just presented. I too am eager to have a wedding at the Taylor Bray Farm. and have loved that location throughout my life and used it as a child growing up and going there on field trips through my entire adult life. We're eager to have a safe event at this location, which we work closely with, I hope, this board to ensure the safety of all of our guests and any town stakeholders and workers that may be involved in our event. And of course, are excited to make a financial contribution in addition to the many hours in kind contribution that we've made to the farm and will continue to make for our lifetime. Thank you very much.
Thank you. Congratulations. Stay safe. Anyone else in the public like to speak?
How many, Elizabeth, how many people were you looking at your wedding for right now?
We're looking at for about 130 with additional staff, keeping in mind the state restriction prior to the governor's announcement last week that lifted the capacity for outdoor events.
Yeah, okay. That I do have your application in here to review, so thank you.
Of course, thank you for your time.
Anyone else? If not, we can work our way down the agenda. And why don't we go, actually, I think it would make sense to go right to the outdoor events state regulation. Let's do that next. Director Murphy, anything you want to tell us up to date? I mean, we maybe just where I can, just what the dates are and when things are changing in the regulations. If you don't have in front of you, I have some of it here that may be relevant.
I'll defer to you right now, then, Mr. Chairman.
Yeah, certainly the main change, which is, this is all part of phase 4, step 2, about industries and gathering changes. And I have it here as effective May 29th. The change to gathering limits includes an increase to 200 people indoors and 250 people outdoors for event venues, public settings, and private settings. In addition, which was effective on April 30th, in reference to face covering orders, face coverings will only be required outside in public when it's not possible to socially distance, and at other times required by sector-specific guidance. Face coverings will still be required at all times in indoor public places. And one item here I saw was face coverings will also continue to be required at all times at events, whether held indoors or outdoors, and whether held in public or private home, except for when eating or drinking. So all this is certainly relevant to the two people who came forward and talked about their weddings. Bruce, any additional comments? If not, we can just ask the board members. I have a few thoughts also. So
we did include a slight checklist for the board to consider. I think was developed by one of the board members on regarding a COVID safety plan, just to work with the people. I mean, it's a draft. I think Mary constructed it earlier. You might have had some input, and it just talks about the number of people that would be at an event, and then just what their safety precautions would be on wearing a mask if there's people going to be close together. Tables, maximum number of people at a table. And we're going to have to look at buffet lines, whether that's going to be eased up or not. So I think there's a couple areas in this chart we could look at, but I think it basically has what I've asked or discussed with people. So I think following the governor's orders as we go forward with people submitting a safety plan, I think I could look at that using this guideline from the board. So not each of the weddings would have to come back for review. as long as they're under 250 or an event under 250.
Okay, board members, how about some discussion and questions?
Mr. Chairman, what was your, you had read part of the new state guidelines in the last item that you read stated that at events, masks were to be worn both inside and outside. Is that correct?
This is what I have, and what I'm looking at, so everyone knows where I'm getting this. This was a release on April 27th, 2021, from the Baker Political Administration, okay, in reference to reopening regulations. Now, specifically, are you looking for comments about just events? Eric, what are you looking for here? And I can-
Just some clarification, I guess, because we had, I mean, as we know, masks are no longer required outside if social distance can be maintained. But it sounded like that conflicted with the last point that you had just read. So I'm wondering what, I'm just looking for some clarification. Is it the fact that it's an event that you're still required to?
No,
have
it's good.
space?
Yeah, it's good pickup on your part. Yeah, and I was aware of that, and it's a little confusing. The statement here is face coverings will still be required at all times indoor public places. That may be relevant to weddings or whatever. Some maybe we'd have to look at, you know, if weather is bad and there's a tent, how does that qualify? We used to look at that earlier in the pandemic of how to consider what are tents of indoors versus outdoors. It also says face coverings will also continue to be required at all times at events, whether held indoors or outdoors, and whether held in public space or private home, except when eating or drinking. So if we're just going to be speaking tonight a little bit on the weddings, those are events. And that would be important for people who are hosting that and the guests, that people need to be wearing face coverings until that's lifted, I guess. If people are maintaining 6 feet social distancing, which I assume is still at 6 feet, then I guess it's questionable whether or not they don't have to wear a mask or not. So Bruce, do you know for sure? I mean, it's vague, it really is.
It's vague, and I think we still hear from our meeting Friday with the state, they're still coming out with more clarifications.
Good.
And I think they're looking at when it's not possible to social distance. That's what they're trying to zero in on the events. But we're hoping to get more clarification probably this week on that section.
Yeah, I mean, you know, you made reference to you know, buffets or whether you're talking about people hugging each other, they haven't seen each other, and if in festivities like this, people standing, drinking, talking, hugging. I mean, so it's complicated. I think it's important that people who are hosting events need to keep this in mind, that they know what the regulations are before they're planning, you know, these expensive, you know, events. That's all. Obviously, regulations could change depending upon what's happening in the pandemic, and that's complicated for someone who's, you know, whether they're renting tents, they've already hired caterers, and so on. So there's some risk involved, I guess. Our board needs to decide what regulations to follow, how we want to go about that. And that, I think, is important for us to discuss tonight. It's on the agenda, and it's not just specific to, you know, to weddings. You know, hopefully things continue to improve here, in reference to the people, the infection rate that we're seeing. But we don't know for sure, and that's hard when people are planning things that are 2 or 3 months in the future.
I think we could follow the governor's regulation and standards for now. We're waiting for, clarification on that, but I mean, they've increased the outdoor size to 250, so I think that's a good working spot that we could work with, and then just get clarification on, they kind of go back and forth on both that, first they say, you don't need it outside, and then they kind of go back and say you may need it outside. So
Right.
I think we need to get a little clarification on that. But I think that's something that I could work with once we have that and relay that to applicants coming in.
Yeah, maybe we'll hear tomorrow at the state meeting or Friday. Hopefully we get some more information.
Yeah, and I guess I would just like to bring it to the board that once we get that clarification, I can relay it so these people can continue without coming back to another Board of Health meeting, that they can set their wedding dates and start lining up all their caterers and event that go with the program.
Yeah, I mean, once again, it's important for people who are planning these that they need to be aware there are, some chances things could change. That's all.
Right.
And that's not, Board of Health is not changing things right now.
Correct.
The Board of Health is going to have to make a decision of what to follow and so on, and some regulations, whether we're just going to follow the state, which is one thing we certainly can do. Bruce, I think it's important the board members see the guidelines. And I know I looked over the material with Mary. Was that in the packet?
Yes.
The added list of things?
The added, no, not the added list.
Yeah, that's important because that's going to be part of an application. It needs to be that the people need to be reading it, and we'll have to talk about whether they need to sign it or whatever.
Right, I thought, I was looking at that would just be a guideline for myself and the office to use, that each one wouldn't be coming to the board because the board might, depending on their meeting frequencies, that they would submit this as part of their safety plan for their event.
Well, I certainly feel more comfortable if the board reviewed it and agreed that the application's okay. I think that's important. The board can make that decision on just what people are going to be reading and have to abide by. In other words, it puts a lot of responsibility on the people hosting. There's also something to keep in mind about the maximum number of people. It has to do a lot of people working at these events as well, in the sense of numbers. A lot of organization. You and I saw that certainly with the graduation plans. It's a lot of work to make sure, that the regulations are followed. That's all. So people are safe, and it can be a joyous time.
And what size number would you want to have come back to the board? Because we have weddings that are 50, 75, 100, or do we want just the large ones that are going to be over 200? Because I mean, we have quite a few events going on, just not at Taylor Farm, but whether it's Flax Pond, at a beach. I mean, there's quite a lot of events going on in town that would require review and permitting.
For sure. I know we have a pause right now. So board members, I think, need to decide, in other words, for what number of individuals or people will be present. At what point do we want to review applications?
I think it's, I think it should be, I mean, after the 29th, they can have more than 250 people anyway. So am I correct?
It would be 250
200
people.
inside, 250 people outside.
Correct.
Right. So I would think anything after that, after that date, that is within those guidelines, doesn't need to come to us. And anything between, if there's somebody who wants to do 200 before, or 250 before that changes on the 29th, then that should come before us. Basically, we should be just following state guidelines in terms of dates.
So following the dates from the administration then and numbers.
Yes.
Okay. Eric, Charles?
What's the latest on the positivity rate in the state? Do we have that number?
I don't have the state positivity rate with me. I just have the town's positivity rate.
I know a week or two ago, it was hovering around 2% or so.
Yeah,
I
it's
think that was
approximately
about what the
Yeah.
state
I-
was.
Yeah, I mean, my only point in mentioning that, I guess, is that Yarmouth is significantly higher than that. We're over double that, right? Because we're still above 5%. Is that correct?
That is correct. We are moving down. Yes, we are still a red high-risk community, but the last week, our numbers have decreased, and it looks like we hope to continue that trend and go down into a lower yellow, they would say.
Yeah.
Yeah, no, Eric, you're right. We're an epicenter, certainly with the P1 variant. That's true. And right now, we're still the highest on the Cape. So I don't know if we ever heard back from the state, Bruce, of what their feeling is why.
No,
We're an
I've
epicenter.
not.
I mean, I would be much more comfortable following the general state guidelines if we were not, still considered a high-risk community. Obviously, we all hope that will change and change quickly.
For sure.
Yeah, we're hoping by this Wednesday, Thursday, we'll know if we've gone down. The numbers that we're seeing right now would project that we probably would.
When do these events start? I mean, are they already going on?
We've already approved I've already approved a couple smaller weddings at like less than 30. But we're gonna have more coming up now for use of different properties, and it might not be a wedding. We also have some small family gatherings of 30 people that want to come in. And there could be also some corporate or worker gatherings also in the smaller number.
Yeah, question is, are all places on the, in the state, should they be handling this the same or not? That's, we each need to think about that as a board. Should we be conducting business the same way of another town that has, a rate that's, a fraction of what we have?
I got Charlie with me. He's got a couple points.
Oh, great.
I don't think I got a point, but I do know one thing. If I was getting married, I need permission from the Board of Health now. Is that what you people are telling me?
This is a discussion, Charles. I don't think we're telling anyone. We're having a discussion, and you're certainly welcome to participate. What are your thoughts on it?
Telling you, I think we're getting involved in a lot of stuff that we shouldn't be, but
Follow the governor's orders, or
well. Want me to speak to him?
no, we're live right now, so.
So. No,
Anything else? Charles, anything else? Guess not. Yeah, no, we're just taking seriously of how to handle this. I mean, that's what we're having to do is a discussion. Serious matter, 34 of our residents have died from this disease. Let's not forget that. And numerous people have been incredibly sick, hospitalized, and so on. So that's why we have a discussion about it.
I know that the governor's made it clear that it is also, it is the responsibility of the local boards to develop their own guidelines. Isn't that correct, based on the statistics in their town?
That's correct.
So, I don't want to prevent anyone from having their wedding. I'm not suggesting at all that we do that. I'd be happy to follow the governor's guidelines, possibly, if we were not in a red category. So maybe if we were, let's say, below a 5% positivity rate, no need to bring it to the board. It's just an idea, I guess.
I mean, it's certainly, the board just meeting, let's say twice a month is what we're doing. Yes, that could slow up the process of people planning these events. Perhaps we'll pick a different number that, I don't know how people feel, whether or not if there's a certain number of people who plan to be present at one of these events, the people who are invited as well as people working there, that maybe that needs to be reviewed. I don't know how people would feel if Mary or myself reviewed it with Bruce and go about it that way, if that would facilitate people planning these events. So we can pick a different number than 250 for the reasons that Eric is mentioning.
I guess I'm not necessarily concerned about the number as long as it's adhering to state guidelines, but the state has a positivity rate of, let's call it 3. The town has a positivity rate of 5. So, does that mean that we're in the same boat as the rest of the state? No, not really. We have extenuating circumstances. So, if we didn't have a 5% positivity rate, then I wouldn't see it as any issue to simply adhere to the state guidelines. But that's my only concern. If we were in a certain level of positivity rate, I wouldn't have any objection, any desire to be involved in the process. That's, for me, I guess it's about the positivity rate more so than the number of people at the event. Does that make sense?
I think that, it comes down to risk, of course. I'm sure, my guess is, yes, if the state had a positivity rate of 5%, probably they wouldn't have increased the public outdoor gathering up to 250 from 150. It probably would not have occurred. But the reason why I think numbers can be important is just the logistics of having a certain number of people in one place. So I'm not sure I feel the same way. If I understand you correctly, Eric, is that numbers may be very relevant only because of social distancing, perhaps, or that maybe would increase the risk of spreading the infection if someone was positive and was present at an event. So that's why it may come down to numbers.
Hello, Mr. Chairman, the thing in our packet that says Yarmouth Site Rental COVID Safety Plan, is that a draft or is that something that we're actually using already?
Bruce, it's not up on the screen, or maybe it's about to be. We'll see. Let's take a look together. I'm not sure what document you're referring to.
Gotta go way down. Yeah. No, keep going. No, it's keep going. It's almost at the end. Yeah, keep going. Keep going. Keep going. It's after this. It's at the very end. You can just shoot to the end. No, come back just before the minutes. Keep coming. Nope, before that. Nope. Hope you didn't leave it out. Oh, there it is, right there.
Okay, so Bruce, it's in the packet then.
Yes.
Okay, I didn't realize. I don't know if maybe it was down. I just thought it was the update for COVID-19 stats. Okay, good. Maybe everyone can just take a look at it. This looks like it's a
I know it's just the first draft because things are going to change.
Yeah,
So it's just a draft. It isn't something that we're giving to
No.
people saying, hey, this is what you need to follow.
yeah, that's correct. Mary started out, I reviewed some of it, and it's only a draft. That,
Okay, well, I didn't see a draft. I hadn't seen it before, so that's why I was asking.
I haven't seen it in a while either until tonight, so I'm just looking at it.
Oh,
Sorry, I've gotten called on by Robert, but I have to.
going to put me back in.
Okay, that's fine. As you can see, it would have to be updated, right? As regulations change.
Right. Yeah, table size goes up to 10.
That's, yeah, the 6 feet between tables stays the same, right? At least now it does.
Right.
Yeah, and it increased to 10 at a table at certain date. I don't know what date,
Yeah.
offhand, I don't recall.
I guess I'm looking at right now, outdoor weddings. We may have a wedding indoor at Flax Pond. I don't have anything before me now, but I know that is a site that's used at weddings. But right now, the two that we have, well, one is after August 1st, so I don't think that's going to affect us, but Elizabeth, that's going to have hers earlier. It is outdoors, where they probably going to have a tent. But tents don't really always have sides on them, so it's an outdoor event. I guess you would probably just need a mask if people are close inside the tent. So obviously, if they're just outside and not gathering and can social distance, that would probably be fine. So it's really just number 2 would be changed to 10 and people, but it's really just number 1 on the safety plan discussing with people. Obviously, we'll look at when music is playing to make sure that they set up appropriately spacing between where the band is and where the public is. This is pretty much following the governor's reopening plan. So.
Okay, let's see if we can move this along. Yeah, so the draft certainly has to be updated based upon change in regulations. And just board needs to decide if it's okay. I mean, Bruce can work with Mary on it. I'm okay with that, and maybe just to bring it up to date.
And I had a question too. So where it says hand washing stations are provided in sufficient numbers for those in attendance, do we have a guideline somewhere? How many per people they're supposed to have, or?
No, there's really no set standard on the number of porta johns or hand washing. We just try to think of what's reasonable, and it's usually for a number around 150. You usually talk to people, it's probably going to be about 3. Could go to 4.
How many per individual present at an event?
Well, it could range anywhere on the size of the event. I'm thinking like a 200-person event, probably going to have 4 with 2 hand washing stations.
So 50 is sort of an estimate of.
Yeah. How long will the event be there? I mean, that's also something to consider. But I just think using that checklist we can let people know ahead of time, this is what they're gonna have to follow. We need to know how it's gonna get set up. And the guests might have to wear masks if they're all gonna be under the tent close together. I mean, because you're not gonna be able to social distance everybody under the tents.
Right.
And we'll have to look at where the band's playing and that there's social distance back from the audience or the people. But it's all something that's workable. And I'm just trying to think that, we'll just follow the governor's orders. We are moving down, as Eric had mentioned, we hope to be, in a yellow community and hope to stay down there. That this is something that we just kind of update this draft, and we can try to do this in-house without, coming back to a Board of Health meeting, so people can start their planning, because, it is getting wedding time. And I know we have a lot of anxious people that have been making inquiries.
Right, which is great. I mean, it's great for the town. It's great for the people, who are invited, and certainly the people who are hosting. Is the board okay with either Mary or myself just reviewing what the guidelines are and what these people, the applications, people okay with that? As opposed to bringing it in front of a board.
So in essence, this is just a friendly reminder to everyone on what the expectation is.
That's most of it. It's also important to realize that something could change. We hope it doesn't. Would something have to change if there's, dire conditions for whatever reasons of spread of the virus, whatever, that these people have to realize that. Hopefully that does not occur. Bruce, I mean, how does the board feel if there's over 150 people who will be present? I'll or Mary will review it with Bruce, and it would not have to come in front of the board. Okay.
Regardless of the state's timeline? So even after August 1st?
It's a discussion. I'm not making a motion. I'm just trying to get
No, I
something.
know. I'm just asking for clarification.
Yeah, I'm just thinking large events, and have someone review it. Same, and it could be Mary or myself to look at it. And just facilitate things for these people, and not have to wait for a board meeting. It's just to go over it briefly with Bruce. It could be over the phone, and just to see what it looks like for these larger events.
Sure, I think it's great.
Yeah, I just think we'd move along if that's okay. Charles, is that okay with you? Eric?
Good with me.
Do you want us to vote on it? Does it matter?
Yeah, I'm fine doing it informally. If Charles
I am
disagrees,
too.
if Charles disagrees, we can take a vote. I mean, that's,
So you're taking everything over 150, and anything under 150 I can do within house, with the staff?
yeah,
And the board wants to look at anything over 150, even past the August 1st date, when the governor opens up everything?
No.
what I was really thinking is, if it's under 150, that Bruce, you would just do it. If you have
Yeah.
questions, you can ask me or Mary. If it's over 150, either myself, it's probably gonna be me, or I guess Mary as a backup would then look at it and make a decision. No, this has to go in front of the board. But hopefully, if it's under 250, it'll be fine. That's all. So if you'll take care of it. If you have questions, if there'll be under 150 people, then your office will take care of it. Contact me if there are any questions. If it's over 150, I will review the plans with you. That would be my thought on it. Board members, is that okay? Then we can just move along on it.
I'm fine.
Fine.
For August 1st, we get out of that completely as the governor opens it up.
I mean, we'll have meetings before then. I'm sure we could revisit it before
Yeah.
that point.
hopefully our numbers keep going down. That's all. And it's hopefully all of this is lifted and we move along. Obviously, you know, COVID's not going to disappear, but hopefully it continues to improve and improve here. And yeah, it'll be wide open. It just gives us the opportunity, if our town is different or worse, or whatever, if that were to occur, that's all. But, you know, Deborah's correct. We're gonna have plenty of meetings before that. So I don't think it's
Like,
important.
and I'll put it on the next board's agenda, because I know we're gonna have people looking at August weddings, or if they even move up that August 1st date to maybe in July, to give people sufficient time to plan, that's all. So I'll put it on the next agenda also then.
That's great. These plans are complicated and expensive. And yeah, I mean, that's really what we want to have is these events. And that's the ultimate goal. And, okay. Maybe we can move on then. If everyone's all right with it, we'll move along the agenda tonight. Any other comments?
Yeah,
Anyone?
are you doing a vote on that, Mr. Chairman?
Why don't we do that? That's fine. Okay. Deborah, you want to make a statement, motion?
Sure. I move that that Bruce will review any events that are under 150 people, anything over 150 people. He will partner with either Hillard or Mary on this safety, the COVID safety plan.
Great, Deborah, thank you. Is there a second to the motion? Eric, thank you. Any further discussion? See, there's none. Okay, all in favor of the motion, just raise your hand, say aye.
Aye.
Okay, it's unanimous. That's fine. Good. Thank you, everyone. Let's hopefully get some weddings here. Okay. Next we can go up one, and it looks like number 2 is the discussion tobacco cap and vote. So we can decide what to do. Is this
Yeah, keep going.
continues?
Right,
The-
yeah, keep going, a little bit more down the bottom of that page. Right there.
So it's really, once again, discussion about this regulation. It's really 2 separate issues here. As I see it again, there are these 2 businesses that obviously are interested in a license, a new license. Right now, with the regulations, that cannot be done. The regulations would have to be different in order to consider whether to issue new licenses. That would only be fair to anyone else who would like to purchase, you know, rather to apply and potentially get a license to sell tobacco.
Can I ask a couple of questions?
Yeah, go ahead.
All right, on this tobacco cap regulation, to get a license to sell tobacco, is it priced? Does somebody pay the town's X amount of dollars for the license or what?
Bruce?
Yes, it's a minimal license. I don't have the amount, but
Okay,
it's
okay, so
minimal.
it's a minimal amount to get the license originally.
Yes.
All right, now when the tobacco cap's full, if somebody wants to get a license to sell, he has to, or he or she has to get buy a license from somebody who already has one. Do I understand that correctly?
Yes.
All right, now what would the price be if somebody was going to buy one from somebody else?
We've heard some quotes. I mean, this goes back months now. I don't know, Bruce, was it 75 or was it 100,000? It was.
Okay, you're talking 100,000 to get a license, which originally is minimal if there wasn't a tobacco cap. All right.
That was a quote from one person. I don't know if that's valid or not. I have no idea what.
Neither here nor there. So you're up a few dollars more. With the time I spent working up in New Hampshire with some of the guys in blue, this would actually be called corruption. So I want you to think about that for a few minutes. You know, you're putting this guy in a position that's got to pay 50 or 100 grand for a license that doesn't cost jack because you won't allow him to get one for the regular price. And, you know, like I said, working with the guys in blue, consider that corruption. So think about that for a few minutes. Did I start by?
You're good. As a follow-up, I did check with our town council about adding a variant section. I talked to him last week on Wednesday. He had reached out to Cheryl Sabara, our attorney from the state that helped us with our last court case, and he had not heard back from her on Friday or today. He reached out and reviewed within their office because they represent several towns that have tobacco regulations, and none of them had a variance section. He did say that we could construct a variance section to our current regulations, or either proposed by Deborah or Eric, that it could be crafted because it's tough to come up with a hardship, and maybe it would be based on a period that, how long it's been expired. Is it for the owner only? And he thought there might be some type of wording that would limit or crafted that would just affect a couple businesses that might be looking for it. Because the difficulty, as the board has discussed, that if it's just based on hardship, everybody would be saying it's a hardship as they come forward to request a license, whether they want to be in a new complex, an existing one that may have had a license in the past. So there's a lot of challenges to try to write a very narrow variant section. He did say that he would be available to discuss that, of how the board wanted to move. But until there's a variant section within the bylaw, which we don't have right now, the board cannot vote to issue a license if we don't have a variant section that allows the board to expand the cap.
Yeah, I mean, one way around it would be just to get rid of a cap and just have a new regulation that there's no cap. That would be an opportunity. Then anybody who wants a license would be able to get it. I guess it's treating everyone equally, which is, I feel very strongly about. That would be one way of not needing a variance, I guess. Is that correct?
Correct. And that is one of the three draft discussion points for the board to consider.
The way that I understand, I mean, correct me if I'm wrong, anybody, but I'm looking at the regulation in front of us, and there seems to be a 30-day variance. Bullet point number 2 under the tobacco product permit cap, you have 30 days within the date your license expires to renew your permit.
Correct.
So that I interpret that as like a 30-day grace period. If you miss
Correct.
the deadline, you have a month to renew the license.
Right. We've been very generous with that. Yes.
Likewise, if you purchase a new permit, if you purchase a permit from a business or an individual, I should say an individual because it belongs to an individual, not a business or property, the way that it's currently written, which I think is an important point to highlight, because the 2 individuals that have come before the board several times now, they did not hold, I could be wrong here, maybe one of them held a permit, but they had permits at their locations. The permits were not held by those individuals that are seeking licensure. But anyway, you have 60 days. So I don't know, I sort of interpret this stuff as a variance. I mean, I don't know, as somebody can comment, correct me if I'm wrong, but
I mean, I feel like
grace
that
period there.
the two businesses in question never had an opportunity. They never had the opportunity to get those permits. They were never notified. They never knew they had 30 days. They didn't have an opportunity. It's not like they had an opportunity and they were like, no, 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 I don't want it. And now they're coming in front of the board and they're like, whoops, I changed my mind. So I think these two particular folks, I think they were just, I think it's they're victims of circumstance here. And there's no avenue, there was no avenue for them in Mr. Bazarski's case. The 7-Eleven held on to the permit. It wouldn't sell it to him. They didn't give him an opportunity to buy it because they didn't want him to open another convenience store in that location. I personally think that to avoid the whole, the permits, $100,000 now, the permits should be given back to the town. And then at that point, I mean, I think you've probably read what I wrote, or what I submitted. And also the hardship piece, Bruce, I took from another town. So I can't remember the town. I think it might have been the town of Peabody, or what. I know actually it was the town of Adams, that they have a hardship, that little hardship clause written in there in case something like this happens.
Well, Deborah, what was the specifics on the other property owner and the license that someone owned there? Do you know, Bruce, what's the scenario on that license and the person who owned that license?
That was the gentleman who we revoked his license. We took it away because he was doing illegal stuff.
Right. That's the only one I can think of where that occurred recently, at least since I've been on the board.
Correct.
That's the permit they're referring to. And that's the permit that Great Island had no opportunity to purchase because they never had it. That convenience store never had it to sell to begin with.
Right. Okay.
So I just want to mention that the permit belongs to the individual, not do we have that literature in front of us here?
For which?
There's a bullet point in here somewhere that states that a permit belongs to an individual rather than a business. So, I mean, that's something that I think needs to be,
Yeah, I don't have that.
that should be part of this discussion, I guess, if we're.
Yeah, because I would say right now, I believe all the tobacco permits are individually owned, not by the owner of the property.
Right.
There might be a couple that own the property, but most of them are leased.
So I guess my point in saying that is that the permit was not tied to either one of those locations. It was tied to the individuals who owned the permits. In one case, it was 7-Eleven. In the other case, it was somebody who screwed up. And
That's correct.
Putting it mildly, yes, he's definitely screwed up. Yeah, no, I'm sure the person who had the 7-Eleven could have been a franchisee. I have no idea. I mean, I think I've made my stance pretty clear is I want to get these folks some permits. I think they deserve them. I think they were victims of circumstances, and I think there should be something that we can do to make that happen.
Well, it sounds like, listening to Bruce, there are two ways that could happen. One is if the board decides to lift the cap. In other words, we won't have a cap on the number of licenses. That would allow for it. The other way, it's having to come up a variance of some sort on a regulation. So it's going about it two different ways. So right now we can't act upon or vote on licenses for these two individuals who are seeking it and, want to get on, understandably so, with their business plans. So that's how I see it. There are two choices here tonight. We can vote which way to go, or we can vote to do nothing. So if anyone wants to make a motion, we can do that tonight.
I make a motion to eliminate the cap completely. And do licenses on an individual basis. And then
So,
all this problem.
Let's see if we get a second.
okay, so as usual, is there a second to the motion? Okay, I see there's not a second, so then the motion doesn't pass. There's no motion. Okay, and that doesn't, okay, so that's out.
Mr. Chairman, would you like me to set up a meeting with town council for two of the board members to meet with town council to discuss wording on a potential variance or hardship?
Well, I think the whole board needs to be participating.
Okay, I can ask.
It's gotten complicated. Everyone has opinions and so
I
on.
know, and that's, I think we need to, I mean, I'm very torn because I do believe there should be a cap. I just also feel like there are special circumstances that we should be able to make decisions on. From what I'm hearing, not everybody's on the same page as me. And I feel like at this point, we either need to vote on the current, either we keep what we have or we get rid of it. And I just don't see any language I propose having yay votes from a majority of the board. And I don't want to drag this on any longer than it needs to be, just so these folks can move on with their lives.
I hear you. Yeah, no, Eric put a lot of time. So did you. Charles wrote up a draft also.
I mean, if Charlie redid his motion, it was seconded and it was voted on and it was didn't pass, would that leave the current regulation the way it is? Or would that lead to more discussion?
No, we would not be voting in favor of removing the cap. That's all that would have done. If that that's the only thing we would be voting on. Then a regulation would have to be written and so on, but we'd be deciding whether or not to lift the cap. So that didn't obviously pass. The other two options, one, vote and do nothing and things stay the same. Based upon that, those two individuals would not be getting a new license, or it's not new, it's a new license. We'd be issuing two licenses. So if we're doing nothing, they would not get be able to apply for a license. The other option is what you were seeking, Deborah, is that we, I guess, continue to look at writing a variance with some legal advice. And that, I guess, would then go in front of the board to vote on. And that, so we have two other options. Those are the two, as I see it. Anyone else? So I think we need to vote tonight on either of those two.
And if we did have a further discussion about the legal town council participation, that would be with the full board.
Yes, I can put it on for the full board. What I was thinking is that we could just meet with him first to say, could he come up with a draft variance to bring to the full board? It would be like a subcommittee of the board to work with town council to bring it to the full board was my thought. But we can go right to the full board at our next meeting on, I believe, the 17th.
I mean, I'd like to come up with some language that everybody, whether they're gonna vote for it or not, could sort of agree on prior to us having to do this again.
Right, that was my thought, is like a
Yeah.
little,
I mean, so I would make that motion. I move everything Bruce just said.
Which specifically is what?
That
Can
we would meet with town council, come up with some sort of language, and then once we have that, it would come before a vote.
is that a motion that would be written prior to him coming, or he or she coming in front of the board, or after? When would,
It sounds like town council would draft some sort of variance that we could look at and you discuss, agree on, and then it would come before the board to be voted on. Is that how I'm understanding it, Bruce?
yes. And I would say it would be a subcommittee of the board of 2 members, yourself and one other person. Myself would Zoom meet with town council, understand the clarity that we're looking for. He would draft up something, and then hopefully we could put it on the meeting for the 17th.
That sounds good to me.
So, Mr. Chairman, besides Deborah on the subcommittee, we probably should have one other person.
Eric, Charles, me, Mary? Mary can't really speak up for her. I know she's been active on this, but I'll do it, so fine. Okay,
Thank you, Hillary.
We'll bring it back to you.
Charles? Charlie, are you saying anything?
You already know my opinion.
No, if you want to be part of that discussion, you can be, that's all. No, we know your opinion, which is fine.
Is it a Zoom or is it face to face?
Zoom.
I don't Zoom.
You're zooming now, Charlie.
That's all right, but I'm zooming on somebody else's computer, honey.
Hillard, I'd be delighted if you would join me on this.
And then you'll bring it back to the full board.
And then we'll bring it back to the full board.
Okay.
Now, someone's taking the minutes on this.
Good
Yes,
luck.
we do.
Good luck to them.
Right, let's see if you get a 1-sentence or 2-sentence motion, and that's only fair for whoever's taking the minutes here tonight.
All right, I'll do my best.
Whatever you come up with is gonna be
I'll
fine.
do my best.
Thank you, Deborah.
You're welcome. All right, so I move that we have a subcommittee of Hillard and myself meet with town council regarding some variance language. And then we will bring that before the full board for a vote.
Hey,
The
Deborah,
next
that's
meeting, I don't know.
nice. 5 stars in that, thank you. Is there a second to the motion?
Second.
I see a second there, that's great. Any further discussion? Hopefully there's none. And, okay, all in favor of the
Now
motion,
to do all that.
raise your hand, just say aye if you're in favor.
Aye.
Charlie,
Yeah.
thank you. Fine, that passes. Congratulations, everyone. I just feel badly for these 2 people who,
I really do, but you know, we're getting closer to an answer. So
yeah. Okay. Sounds like they're in pain. Okay. It looks like it's update coronavirus time, number 4 on your agenda. Director Murphy, this usually is on your plate.
Yeah, okay, let me just scroll down to our chart. Yep, keep going. There you go. Okay, can you go down a little bit? There you go. And they can see it all the way across to the right. Can you, Mr. Chairman, can you see all the way across to the end of the chart to the right?
Yeah,
Okay, good. You can see the third wave is going down considerably. the end of April to May. And what I did is I put a tab down on April 27th. We only had 16 cases, which was daily cases, which is pretty much down when we're running 80 to 100 cases that we're monitoring. So we did hit a low, which was the last time we did that was over 5 months ago. On November 12th, we had 16 cases. So just by looking at this chart, we can see that it looks like we're subsiding the third wave, which is good. We do have a small little bump here. I don't see it going up, as noticing the other Cape towns have moved down to the yellow, especially on both sides of us, being Barnstable and Dennis, along with all the rest of the Cape towns is yellow. So I see us going down. Our cases, since Friday, we had 5 cases on Friday, 5 on Saturday, 2 Sunday, and only 3 today so far. So it's way down from when we were getting 10, 15 cases a day and then monitoring 70, 80 cases a day. So I think we're moving in the right direction. We're just over 5, and I would anticipate moving into the yellow on Wednesday. Okay. So what we have is from the beginning of the pandemic, last April, we've had 1,500 cases, and we're monitoring right now 24 active cases. Okay. Just the age breakdown, where we're trying to look at the ages, and we can still see that the total on the right is over the last month where the cases are coming from, and we can see the highest 67 in that age group of 30 to 39, but it's pretty much between. It's followed up by the 63 in that age group, 11 to 19 to 20. That's right up there, and that's individual cases that we're getting from sleepovers, birthday parties, and close contacts to those. It's not picking up in school. We're picking it up before it gets into school. It's not multiple kids in a classroom. And then we see it, pretty much in that age group from 20 to 60, the working area that have kids and are working are where the cases are coming from. But that has been decreasing this last week. I just wanted to show you that overall. Thank you. This is the new chart. Just scroll down just a smidge so I can see the bottom. There you go. So this is the 7th consecutive week we've been a red high-risk community. We just over at 5.09. Dennis is down to a yellow at 4.9. So they did lower. We did go lower. We were higher, but we did move still in the red community. So it looks like the whole red is
What's the deal with
decreasing.
Wellfleet, Bruce?
Pardon?
So deal with Wellfleet. It looks like they're higher than us.
Yeah, they're still in the green. They're still in the green, and it's based on population. So even though it says 6, it's based on their population. So it's a little deceiving on that. Same with Truro. They have such a small population that it doesn't kick into considered a high risk area based on their population size. That's a good pick. And same with Chatham. So I think, go back. Cape-wide, the percent was 3%, 3.4. So the state was lower than that. I think they were just under 2. So I think everything's moving in the right direction, and that's probably more to vaccine and some people taking precautions, but we're still seeing from tracing coming in, precautions are still needed. Okay, those precautions that I mentioned, avoiding gathering, dinner parties, birthday sleepovers, We just had one come in Friday on a sleepover from high school age kids. 5 kids representing, or 7 kids representing 5 towns out of our school district. Are all, 2 were positive and several others were close contacts. So it's all ages that are having the sleepovers that really need to be thinking they need to take precautions and not have sleepovers. I just can't say it enough. I mean, we've got that age group. It's just not the young kids that you're thinking of 12 and 13 sleeping over, or 8, that this is high school kids that we're doing a sleepover. And we're still having some birthday parties that the young children and parents are at. So we still need to take precautions. Okay. Again, just showing the spread before we get into our next one. So we are on the right direction. We did get a little bump up, so we still need to be precautions. You then roll into the news release from the governor that was issued last Thursday that Hill had mentioned, and affected Monday coming up. As we go down a little bit, we see road races are coming back, which is interesting because we could have a road race. I know a couple will be coming to us that will probably ask for a size of either 200 or 400, 500 people outdoor organized road race that will be coming to us before August. So that would be one, according to your new discussion tonight, the board would review. I think we'll have a couple of those staggered starts. Obviously, before or after the race needs to be considered. So I think we start seeing that again. Singing will also be allowed May 10th. We've reached out to a couple of our establishments that have indoor singing and mentioned what the guidance is. You know, it's musicians are 10 feet apart and 25 feet from the first person in the row of dining. So we've reached out to them along with the Chamber of Commerce, who's also reached out. Then we go into effective May 29th that the board talked about as increased sides of the 250 going to outside from the 150 to 250. But also being permitted is street festivals, parades, agricultural festivals at 50% capacity, which is really kind of hard to gather. You just don't know what a street festival could be, you know, a couple thousand people. So, and then affecting August 1st is that's when it's all open to the public at that point in time. It's all listed and capacities go to 100%. And that may come before August 1st. And this is the April 30th. The chairman mentioned the face covering is only required outside if you can't social distance. And then it goes into face coverings. This is where it gets a little not as clear. Required all times indoors, public spaces, and will be continued at all times in events, whether indoors or outdoors, and that's what needs clarification on. So that's the governor's update. Then we just kind of, here was the checklist that we looked at for the wedding. So we could skip right over that. We go into vaccine right now. Vaccines becoming more plentiful on the Cape, which is great. We're getting to see some more down here. And I'll go to the next slide. It's on the homebound. We're doing a great job. This is they went out last week and did Johnson & Johnson. And they did about, I want to say about 30 people. So that's the 3rd time out. They're going out again this Thursday, the fire department with the paramedics and EMS are going out. Calls are being continually being made by Diane's Kane group at the senior center. And that will be finishing up our homebound. We did have a couple people drop down off the homebound because either they went to the hospital or somebody, they made a huge effort to go to one of the local places. So that's working out very good. So we're still taking a few calls today and yesterday. We just signed up 2 people for a homebound that had circumstances change. So we can still be calling the Council on Aging at this number. And if you call today, Monday, Tuesday, and even possibly Wednesday morning, they'll try to get you on the homebound list. That's the number that's been going out for over a month. As we see from this next news article from the September 24th, Cape Cod Healthcare had received 6,000 doses, and they are doing more vaccination clinics at the Melody Tent. Also, we have Harbor Health of Hyannis working with the Barnstable Seniors location, and they're up to a walk-in at this time. You can go back up, go back. I want to see if there was, I think there was a phone number associated with that. If you go scroll. No, I think they just said for the, right now, the hospital is just go to the website, capecodhealthcare.org, and you can register that one. I do have a phone number later in this meeting to discuss. I did send this notice out and talk to the Chamber of Commerce and the Restaurant Association, the Senior Center, and I sent it out to all town departments and general names within the town. We do have another vaccine clinic right here. Go ahead, you can go right down. That's the, yeah, let's go right, yep, go, yeah, no. You're quick on the hand, yeah. You gotta go all the way. Well, keep going down. Yeah, keep going backwards then. Keep going. Yeah, you're going the wrong way. Go the other way. Yeah, keep going. Right there, that one. The Melody Tent is having a clinic this Wednesday, and there's a lot of shots and appointments still available. And that's this Wednesday, 3 to 7. Cape Cod Healthcare is doing it through the hospital. And if you call this number, you can make an appointment for 3 to 7 for this Wednesday. And they're hoping also to do it again on weekends and next Wednesday. So an important number. I provided this number to the Chamber of Commerce, who sent that out today. Also provided it to Senior Center, who sent it out their email list of their 2,500 people. So we are trying to get it out to that age group that we're looking at that may be working during the day. This will give them an opportunity to do it after work. And they're using the Moderna vaccine on this. So that's a very important number to call. And I think we can try to reach out and get it up on our social media too. I'll ask Kyle to push that number out to our social media. So we're getting a lot more vaccine in. I think that's good news for getting it out in the community. Okay, that's the vaccine report.
Bruce, can I ask a quick question? Are
Yes,
we able to get
questions on that?
that information? I know it's only 2 days away, but on one of the electronic boards?
Yes. The person that we have updating the boards is out on a medical leave right now. We're trying to talk to that person to get this up on the board, so we can see if we can get it up for this week. If not, as we go forward, we'll do that. And we'll look at what we can put outside manually on our other board. This just came out quickly today, so it doesn't give much time, but we'll try to keep this number available as much as we can.
Just a short robocall, just with the phone number, date, place, may be helpful.
Okay,
Thank you.
yeah. If there's no other questions on vaccine, this was a question that a board member had brought up at the last meeting. Our grant that's going forward with Substance Awareness Committee. that myself and the board is on, that we're working right now with the county, Barnstable County Health Department or Human Services on their grant, which we received last year also. This one is substance awareness that we're working with the high school and middle school on, and working with the principals on that to get students to come up with a art design or a social media design. We will purchase the equipment or artwork for them within, I think it's $100, so they can put something together. And then at the end of May, there'll be a showing at the Yarmouth Cultural Center. So that's something that's very active, that we'll be in touch with the schools this week to get that going. And then we'll have the event at the end of the month. I think it's a Friday, Saturday, Sunday. That's all I have, Mr. Chairman, as we head into the minutes.
Okay, great. So next up is, yes, number 7, approval of the minutes. That's the meeting of April 26th. Everyone had a chance to look at it, or you can just scroll down on it if it helps you see what the subjects were. It's nice we have the minutes back in written form. That's great.
Under
Uh,
number 6, is that, should that be a hadn't or a hasn't? Hadn't instead of haven't?
Where, again?
Number 6,
Or haven't seen,
Have not seen.
hadn't. It's been a while since I've.
probably should have, hasn't.
It should be hasn't, because board is singular, though there are multiple members to the board, so grammatically, we can make that change. Okay, thank you, Jamie.
I didn't hear the comment, Pat. You're saying,
It might, the board member might have said haven't at the time, and we might have taken that down, but I think it's, the intent is there. I think we could approve the minutes if there's no other corrections as is.
I agree on the grammar front. What do you think? What do you think, Eric? You're closer to this. I think board is singular, so maybe.
He's
correct.
very married to making sure it's proper, so whichever
Let it slide.
is proper.
Right.
Yeah, I would defer to Mary, but.
Ah,
So
Yeah,
I think what happens sometimes is we're not always talking punctually correct. And our secretary is right on top of it, getting all the words. And I do have to say, we do have our new secretary back at the hired within the department. We're very excited about. And Eric is working in the housing division and has probably been with us 3 weeks, and is also our new, we'll be doing our board secretary work.
so we can give it quality, we'll give it a 99% then, okay? Just the one issue, Eric, that you brought up. If people are okay with that. You want to make a motion here to accept the minutes?
I move we approve the Board of Health minutes for April 26, 2021.
Thank you. Is there a second?
Second,
Okay. Any discussion? I see none. All in favor, just raise your hand, say aye. Pass.
Aye.
Charlie?
He's up, yes, unanimous.
Great. Okay, moving along. Okay, so new and old business. Director Murphy, do you have anything, or any of the board members have anything?
All I have is our next meeting will be in 2 weeks, May 17th, Monday, May
Right.
17th, 5:30.
I only have one thing. Anyone else have anything?
What, I'm sorry, say that date again, Bruce. May 17th, you said?
Yes,
17th,
Thank you.
5:30, just so the public is aware, that's our new starting time. And the only issue to bring to everyone's attention, and with people watching the news or reading about it, is the vaccine hesitancy is a real issue. I can tell you, I've been at a lot of sites giving injections for the vaccines. And there's plenty of vaccine, but there are times I'm sitting there with other physicians, other volunteers, and just waiting. There are people who are not showing up. Some people, or just people not calling, making appointments. I've been at sites where we've had walk-ins, that we would have taken walk-ins. So it's just the opposite of what we were struggling with. Now we have more vaccine than people are interested in getting vaccinated. On a national level, I don't know about the state, but nationally, it's felt between 30 and 40% of the population do not plan on getting vaccinated. And I think it's 8% of the people who are not coming back for a second injection. That's if they're either taking, the 2 medications that have required 2 injections as part of their regimen.
Hillard, why do you think that is? If they've gone and had the first one, what do you think the hesitancy is on getting the second one?
I don't.
You think it's just a hassle at that
Yes, it
point?
is.
Like, just.
For sure. I think that's part of it. People feel, well, I got it, I'm good. They do, if you read it, it's probably, you have some protection for sure after the 1 injection. You have a lot more if you already have antibodies and you put in the another dose. Yes, you'll have more of a reaction. It works. Yeah, people not showing up, 8%, but I don't know the rate here, in our town. It could be higher, it could be lower. I don't know. But the site I was giving injections today, that several people, they were saying, yeah, people didn't come back for the second shot.
Some of the comments that I've heard from people that do have some hesitancy are, and I don't know really the validity of the statement, but that it's not approved by the not been approved by the FDA. That was one comment I heard, and another comment was that we don't know the long-term health implications associated with it.
When you say it's not approved by the FDA, what were those people thinking? I mean, I'm not sure.
I'm not sure if that's just misinformation. I don't know anything about that.
Right. Certainly, we have 3 in this country they're given. Those were obviously cleared. There are plenty of other brands or types of vaccines that have not been okayed in our country. Yeah, some of it is education. Part of it is, I guess, fears. I don't know. It's new in this country. If you look back by history, this was not the case for smallpox or polio. There wasn't this hesitancy that we're seeing now. Something is certainly different. I don't know if there's things we can consider doing in town. Education is the only thing I can think of. If there are ways to, be able to answer questions or give some facts in some way. This is long from being over. I mean, we already hear about boosters, and we're hearing about the changing in the virus, all those mutations. You're reading about India this week. It's horrific. They have a strand there that's killing a lot of people. I don't know. Anyone have any thoughts? Anything we can do? I mean, it's our responsibility in town here.
I think it would be great to have a Q&A session if there's people with questions, with concerns regarding the vaccine. I don't know. I mean, I don't think I could answer them, but I'm sure. I called someone from the Barnstable County Health, and I got somebody right away. They didn't know specifically the answer to my questions, but they hung up the phone and got back to me within 5 minutes. They were very helpful.
Oh, that's great. I'm sure we could probably steal some Q&As, from online, and perhaps we can post them on the website. Bruce, maybe we can gather those. I know the state, the website has a lot of Q&A there that we could perhaps borrow and put that up. I don't know that people are spend time looking at our website. I don't know, looking for answers.
Yeah.
Do we still have the Megatron at the transfer station?
Yes,
What's currently being displayed on that?
it should be, and I got to check to see if it's been updated. Like I said, the person's been out on medical, but they should be back checking it, be able to put it up, but it's the total number of cases and the total number of deaths.
I wonder if we could, put vaccine questions, visit, I don't know, visit such website or something.
So Bruce, at this point on the Cape, do we have so we have we have the vaccine that we need if we needed to get everybody vaccinated at this point?
We're heading in that direction. What our weekly allotments has been increased. We're heading that direction, yes.
And then I know, so in my case, I got my first one in Marshfield, and then I actually missed my second appointment. I just got stuck at work, and then there was the traffic getting off the bridge. And then I was able to secure an appointment at a CVS 2 days later to get my second vaccine.
Yes.
So there's CVS and Walgreens, and all those places have them too. And it's super simple. They make it so easy to just go online and book it and go and be done with it. So there's more avenue. I just think too, it probably would help if we could explain that there are other options other than just these main mass vaccination sites.
There are a lot of signs up. It took us a whole year, Bruce, to get some high quality signs up there at the transfer station that are up there now that look professional. And those are the ones that are saying wearing a mask, which may not be as important of a message as getting vaccinated.
Yeah, that's what I'm thinking as well.
Bruce, maybe we can talk about that and see about at the signage there.
Maybe we can have a max vac site right near the dump.
On the plus side, there's more masks at the dump.
I know. I ask my husband every Sunday, was everyone wearing a mask?
Last thing, when I set up a meeting with our town attorney for a Zoom, what's a good time for you, Deborah?
I usually have Thursdays off, so anytime on Thursday is usually best for me.
All right, I'll shoot for this Thursday. Let me see what's available.
Or after 6 o'clock.
All right, okay.
I know it's kind of late, so that's why
All right.
Thursday could be more on the day side.
All right, we'll shoot for a Thursday then.
Okay.
Yeah, I'll speak with you, Bruce, and see what windows of time I can get.
That would be helpful. Thank you.
Okay, sure. Anyone else? If not, we can call it quits here tonight.
Move we
adjourn.
adjourn.
Oh,
Wow.
let Eric have it.
Well, one of you has to second it.
I'll second it.
Okay, fair enough. Any discussion? No, hopefully. Anyway, all in favor of adjourning, just raise your hand, say aye. Charlie?
I was there, unanimous.
Unanimous. This meeting is over. It's adjourned. Stay safe, everyone.
Have a good night.
Night.
Good night, Tom. Sorry I said your name wrong.
Did you say that? What'd you call him?